So, histamine intolerance and a lot of histamine related issues are probably one of those syndromes that encompass a lot of different non-specific symptoms, and it's really difficult to figure out and also really difficult to manage. Hi, I'm Dr. Joyce Knieff. I'm with Yggdrasil Naturopathic Medicine. So when I see histamine intolerance in my clinic and a lot of syndromes that are related to histamine issues, things like mast cell activation syndrome or eosinophilia, things like that, what we generally see is patients who suddenly have chronic hives all of the time that come out of nowhere, or GI distress like diarrhea where they eat food and things just go right through them, or things like tummy pain, constipation, chronic migraines, a lot of very non-specific symptoms. And when we figure out things are due to histamine, a lot of the correlation is with food, but also the foods that can be high in histamine are very, very non-intuitive. So we have the classics like strawberries, chocolate. Whenever someone eats chocolate, they get a migraine, something like that. And that can be fairly classic. But there are also pictures where it isn't so obvious, where someone might eat a food that they cooked one day and fine. But the next day, as soon as that food has been in the refrigerator for about a day, then they eat that same meal again, and then they start developing symptoms. And initially, this looks like a really big puzzle because it's the same food, right? But actually, with storage, with bacterial activity on that food, that actually increases the histamine content in that food. And there are a lot of other examples like this that are along this vein when it comes to tolerance, because not only are there foods that might be high in histamine, there can be foods that are known as histamine liberators that basically encourage the cells that release histamine to release histamine a little bit easier. And these can be things like mast cells, basophils, or eosinophils. And then there are other constituents that could include higher amines in food and things like that that can also stimulate these histamine releasing cells to release their histamine. So just figuring out you have histamine intolerance is kind of a doozy. And when you figure that out, how then do you manage it? Well, conventionally, there's, antihistamines that may or may not work, but a lot of people with just plain histamine intolerance who have a lot of gastrointestinal symptoms from excess histamine in their guts, maybe the best thing in the moment is to have an enzyme that helps break down histamine. And taking digestive enzymes for dietary histamine is an option, but if you want to address sort of the underlying root cause of why you're suddenly so sensitive to histamines, a lot of the time this involves some amount of gut healing work, microbiome balancing, taking a deeper look into what happened in your immune system that is now causing your gut to be so reactive to histamines in your foods, or causing your histamine releasing cells to be so much more reactive to foods that are known to be histamine liberators. This is a lot of what we do in our clinical practice at Yggdrasil Naturopathic Medicine, where we take a look at the clinical symptom picture of each and every patient. We paint a picture of how did you go from when you felt well to where you are now, and how can we engineer a healing path for you so that you rebuild your body's resilience in the best way that you can now to help you tolerate your foods a little bit better and move through the world in a way that you want to live your life. So yeah, that's a little bit about histamine intolerance. Hopefully that was helpful, and I'll see you soon.